Myself, Dr. Subha Prakash Sanyal. I am the Director of Hematology and the Bone Marrow Transplant Services of Fortis Group of Hospitals, Mumbai. So, whenever we talk about the blood cancer, the first and most important things come about the symptomatology, and whenever the patient should go to the doctor to seek help. Whenever any patient is getting some unexplained weakness, tiredness, which is not common to him or her, or there is some unexplained bleeding like a gum bleeding, nose bleeding, there are some spots, red spots over the body, where the patient is feeling extremely fatigued, not able to do much of day-to-day activities, they should definitely go to their doctor and they should check their blood. And the most important test what we pick up any sort of blood disorder by a simple test which is available everywhere in the city and the country is a complete blood count. So complete blood count gives us a complete picture how is the hemoglobin, white cell count and platelet is, and how the distribution of the normal cells are there or not in your body. With this blood test, is there any abnormality, you should meet any hematologist in your neighboring area or in your city just to identify the cause of this particular problem. Hematology is expanding in a huge space. The most important thing in 2025 is that most of the hematological cancers like leukemia, lymphoma, myeloma, the treatments are moving from conventional chemotherapy to non-conventional treatment like a targeted therapy. Now all the blood cancers, we try to understand that what actually causing the cancer and what is the genetic abnormality is present behind it. And if there is any targetable mutation we are getting, and there are many drugs now already in the market, and there are many drugs already in the pipeline which can help to kill this particular target. We all know the story of the chronic myeloid leukemia, where the CML diagnosis was basically done from a combination of chromosome, what is called BCR-ABL, and we have a target against this particular chromosome abnormality, which is called TKI inhibitors. Like that, many drugs like rituximab, brentuximab, polatuzumab, inotuzumab, so lots of immunotherapies are now available in the market which can control the disease and cure the disease very efficiently, which we can't think even in 5-7 years before. Bone marrow transplant services has expanded like anything in the city and the country. Now at least we have 100+ bone marrow transplant centers in the country, and we are one of them. And our center is a very busy bone marrow transplant center where we do all sorts of bone marrow transplantation, including autologous bone marrow transplantation, allogenic bone marrow transplantation, match unrelated donor transplantation, haploidentical donor transplantation. Very simple word. Now we do very complex procedures of difficult type of the transplantations for all the hematological diseases. Now we are doing, and we are doing very successfully with a very able team of qualified hematologists, transfusion medicine specialists, intensivists, and most importantly, transfusion medicine specialist. Last not the least, the discovery of the CAR T cell therapy and the bispecific antibody, which are available commercially in our country and which is actually a cutting-edge technology which cures significant amount of B-cell acute leukemia and B-cell lymphomas at significantly where previously we don't have any hope. We only used to call that they should go to the palliative care. So more and more patients now coming under the purview of the cure. More and more hematological diseases are get cured with the cutting-edge technology, and that is the way hematology is moving so far very speedily in a coming decades. Thank you.